Hello, everyone, and welcome to the third podcast from the International Society of Blood Transfusion, Transfusion Practitioners Group. I am Louise Tran, Patient Blood Management CNC from Sydney, Australia. Today, in our podcast, we will be exploring audit, and it is one of the many activities that a transfusion practitioner may undertake as part of their role. If you're not sure what transfusion practitioners are, you may want to go back and listen to our first podcast about what is a transfusion practitioner. The International Society of Blood Transfusion is a global community of professionals sharing knowledge to enhance transfusion practice and blood management. The Society does this by providing opportunities for advancing knowledge and education and by advocacy for the welfare of blood donors and patients. ISBT has many working groups that focus on specific topics or areas of practice, and one of those is the Transfusion Practitioners subgroup. So now we're going to meet our guests, Rachel and Jana. Rachel, please introduce yourself.
Thanks, Louise. Hi, my name is Rachel Moss. I'm a transfusion practitioner at Great Ormond Street Hospital for Children in London, United Kingdom.
Thank you, Rachel. And Jana, please, can you introduce yourself?
Hi, my name is Jana van den Broek. I'm from Belgium. I work one day as a TP, a transfusion practitioner in the University Hospital of Brussels in Belgium. And I also work as a project coordinator for the National Health Authorities. And our group is trying to improve the quality of transfusion practices and to facilitate the implementation of PBM, patient blood management, in the Belgian hospitals.
Thanks, Jana. So now on to the interview. So why is audit an important activity for TPs?
I'll take that, Louise. So audit is a continuous quality improvement process, and it targets safe practices in line with all the best evidence we have. So conducting audits is one effective tool within that, and it helps us evaluate our practice, understand the situation we're working in. We can see if there are any gaps between practice and targets. It gives really good information on our performance, whether we're practicing within the guidelines that we've had set, the standards, the policies, the procedures. Also, it helps identify variations between clinicians or clinical specialties. And finally, it does give us some areas for improvement, as well as showing where things go well. It may show things where things could be improved. And data can be collected from many different sources. So audit can be really quick and easy and not take too long. We can call it a snap audit, or it can be much more complex and involve much more what we would call big data, linking databases and such.
With having said that, what type of audits are TPs involved in then?
I'll take that. So in fact, you have different types. It's possible that it's part of a strategic plan. For example, if the transfusion committee looks at all the points that are to be improved in the hospital, they can make a plan, and then following this plan, different audits will be planned. But it's also possible that following an incident, there is the decision to do an audit because it's necessary to improve a certain procedure in a certain hospital service. Then usually all types of audits, they are looking to the practice and comparing what is happening on the floor with a procedure, a guideline. So it's to measure compliance. And in the world of transfusion, you have many options for auditing. You can audit, for example, the whole transfusion process, but you can also put it in different parts, and you can have a look to the informed consent for transfusion, for example. Or you can have a look to the documentation only. Also, if you think about patient blood management, you could have a look to the procedure regarding the screening and management of preoperative anemia. So there are really a lot of options. As I said, you can do an audit in a hospital on a local basis, but it can also be a regional initiative or a national initiative. For example, the health authorities, they can decide to do an audit on O negative, the use of O negative red blood cells, and then the hospitals are asked to collect data and report it to the authorities. What else can I say? So you have really also a lot of methodologies to do an audit. You have different tools available. An important one is that you use a structured way to do audits, and therefore the PDSA cycle is good basis. So this means plan, do, study, and act. So first you are going to plan your audit, then you are carrying it out, then you are evaluating it together with the team, maybe also reporting it to the transfusion committee, and then you will act, suggest points to improve to the care units, for example.
With all that methodology in the background, then how would I prepare for an audit about blood management transfusion practices then?
This is Rachel again. So I think there are several things that need to be considered when developing your audit. So firstly, I think I would search to see if there's any similar audit tools already available that you could use as a template. There's a term that we say in English, which is don't reinvent the wheel, which means don't do something that you already know works. So it's always good. Of course, you need to acknowledge your source for that. So otherwise it's plagiarism, but it's good to see what else is out there. And transfusion, we do like to share what we know. Then you need to consider the data collection environment. So what's your organization? How does it work? What data do you need to collect? What information will be the most useful to answer the question that you might have? And who gives you that information? And when you know it, who you're going to feed back to? So you really need to think about all these parts before you start. And then where are you going to get that information? Are we talking medical records? Are we talking something that you're going to do in real time? Are you going to collect it on an audit tool? Do you have something electronic? Who's going to collect it? Transfusion practitioners are very good at collecting data for audits because that's part of our role. But it may well be that others can do this at a local level and feed back into you. How much data do you need to collect? Do you need a specific time frame? A certain percentage of patient cases? So you don't want to make it too onerous because it becomes too big. You need to have questions that are fairly easy to answer. And then, of course, who are you going to tell your results to? So think about that and what information that you're trying to get across to your audience at the end of the audit, as much about what you're going to learn as you audit.
Electronic patient records are a rich source of information for evaluating hospital practices. How are TPs involved in this kind of data collection?
Well, I'll probably start this by, Rachel again. I'll start this by outlining a bit about electronic patient records, because we know that for many countries around the world, they're not yet in place. We refer to them as EPR, electronic patient record, and I'll use that term as I chat to you because it's just a lot shorter than saying electronic patient record all the time. So it contains everything that a paper record would hold. At the same time, there are live computer programs. So things are inputted in real time. So things like vital signs, medications as they're given, blood transfusions as they're administered. Sometimes these things come straight from heart monitors if you're in an intensive care unit or theatres. And they are used by nurses, by doctors, by physios, by pharmacists. From a transfusion point of view, it gives us a vein-to-vein audit trail. So from the decision to transfuse the patient, from taking the blood sample so that we can do that cross-match, and through to the blood administration. It's all captured through the EPR. Now, there are local and national requirements that define about the data in transfusion that we want to record. And whether it's electronic or paper, we would want to know the indications for transfusion. We'd want to know the name of the professional that administered the blood. And we also need to store about transfusion reactions, so we can feed back to the blood bank and for our hemovigilance collection. So it is a very good source of information. Jan, have you got anything to add?
Yes, as you said, there are different parts that you can use for data collection for auditing. Another important part could be the bedside blood tracking systems. As you know, or maybe know, in more and more hospitals, the nurses mostly are scanning the identification bands of the patients and also the blood bags to ensure the right blood is given to the right patient. And this is, so the main goal is to ensure safety, but on the other hand, it's also a great source of information, because then we know exactly when a patient has been transfused, in which care unit, and so on. A more advanced one is the clinical decision support system. So this is a part linked to an electronic order. For example, when a physician orders blood components, he can get a feedback about the appropriateness of his order. For example, it can refer to the hemoglobin values, if it's according to the recent evidence-based guidelines or not. And then you have also other kind of alerts. For example, when ordering lab tests in the pre-operative consultation, there could be groups of lab tests that are already predefined. So clinicians are encouraged to do all this screening according to the local guidelines. So this is also, again, to ensure safety, appropriateness, but it's also a source of information, and it can be used to evaluate the order process. An important role of the transfusion practitioner is that they can help to develop these systems or to give feedback when a certain system have to be purchased. Also, we can give our thoughts about which indicators are interesting to measure, to evaluate the procedures and to get the right data out of the EPR, because the problem is often that you have a lot of data, but you have to know which data you export and where it can be found in the EPR.
That's right. So Rachel, as a TP, how and to whom do you communicate your audit results to?
So there's a range of people, and it actually does depend on the audit that you've done. So mostly we would report whatever audit we did to our blood management committee, because they oversee all the audits that we do. And from that, we may decide to take that down to specific areas, or we could have just audited a specific area and we feed back to them at the same time. So it depends on the data we've collected. Also, we need to think about, are we looking at something perhaps from a money point of view? So finances, as we know, are integral to what we do in healthcare. So it may well be that hospital executives or finance teams need to be involved in something, but it may well just be it's a local level, so nurses, pathology staff. We have people who might collect the blood. Sometimes that might be nursing staff. It could be there's a term they use is orderlies or some such. So it's important. The most important thing to do is when you're tailoring your feedback, think about the audience and think about who that information is going to, and then what are they going to do about it. So if they were involved in the audit, they may be very engaged in what the results show, because it may well tie in with what they're doing. Or it may well be that they weren't engaged, but actually it's something that they can take away. And also, where are you feeding that back? Are you doing it formally through a presentation, or are you doing it locally? And what do they need to take that information away with them? And of course, there's the organizational culture of feedback. It has to feel safe. If we're highlighting things that aren't going well, people need to think that they can then have the tools to change that. So it's not just about saying what isn't working. It's very important to tell them what is working as well.
So Jana, what sort of materials and methods do TPs use to provide feedback?
There is a lot of choice. So we have the classical way, writing a report. In any case, writing a report is necessary, I think, because then you have something to go back to. Also, later in some months, if you want to do the same audit to see how things have evaluated, it's good to have it all written down. It's also good to use structured template. But next to that, it's also interesting in some occasions to give an oral presentation in the care unit, so nurses can be more engaged because often they do not have time to read a long report. So there are also more advanced ways, for example, a dynamic dashboard, but of course your hospital have to have the resources to be able to offer that. And in all these ways I just mentioned, you can use also, of course, graphs, tables, infographics to make it more visual and attractive. If I may, I will take the opportunity to give some tips for giving feedback in a proper way. So I have described several kinds of giving feedback, but the ideal situation is that there is given a combination of oral, so verbally and written feedback. Ideally from a trusted source. So for example, it could be ideally as a transfusion practitioner, you are well known in the care units, but you can ask also, for example, the chief nurse to assist you to communicate the message and the feedback. It's also really good to focus on the target performance. So it means that you are looking at the objectives of your audit. What am I measuring? What should the healthcare provider follow? Or so it's really good to focus and also give an easy message, not too much information. For example, if you are showing graphs, don't show too much graphs, only the most important ones, and don't make your graphs too complicated, because it's possible you will lose your audience. And also a very important one is to give timely feedback. For example, you know, we are all busy, but it's important that you give your feedback not too late after having done the audit, because the momentum will have passed. So it's important to make your report as soon as possible, and also to organize a follow-up meeting as soon as possible. And then also a very strong one is to do benchmarking. You have to see the situation a bit. Sometimes it's not indicated, but it can be a good motivator for people. You have to see the culture, as Rachel talked before. Also, you can start with anonymous benchmarking, so it's less sensitive. So I would like to conclude with some citation. Your message is only as good as your ability to share it. So think well before you give your feedback.
I love that, Jana. Thank you. So Rachel, how do TPs use the results to implement change?
So this is the $1 million question, isn't it? So what we need to do is start of thinking about, once you've given the feedback and used those fantastic methods that Jana's highlighted, look at the reaction to that feedback. Look at how people respond to it. Were there any barriers as they learned about the feedback and they heard about the audit results? Did they automatically come up with something that they think won't work, or did they come up with things that perhaps will work? There's something called SMART, and it's good to set targets because you can work with them. And SMART stands for specific. So if you're going to do your changes, think very specifically about what they are, so they're not broad strokes. Make them measurable. Has that change actually had any impact? Is it attainable? Let's find something that we know we can do rather than asking the whole hospital to change. Is it relevant? Is it actually going to make a difference to patients? And also, as Jana said, let's harness that. Let's not wait too long until it's all over to do any actions to it. So let's make it timely. and include all the people who are invested in the audit and the data that you've got, so that it feels like it's a partnership and everybody's engaged in the changes you want to make.
I've seen on the ISBT website that TPs have developed position description templates that anyone can use when developing or enhancing the role in their organisation. Rachel, can you tell me some aspects that were included around the audit, and do the responsibilities increase with the advancement of the TP's experience?
So the template actually is a really useful tool for health services to use. And we've purposely developed the template where the specific aspects of the TP role are separated, so the specific aspect required by an organisation could be applied. So when we're thinking about audit, we would imagine that a novice TP, so this is somebody fairly new in the role, and they would be developing the process of the audit schedule. They would be contributing to the audit tool, and they'd actually be facilitating or participating in regular audits. But as they gain experience, then there'd be a much more collaborative part. So they would actually contribute to the reason we're asking those questions and what we hope to get out of it, thinking about whether it's blood management or something of that. But what are the areas that we need to look at? And then thinking about the results, and they'll be part of that. But as you become much more senior, then you're actually synthesizing those results and applying them to clinical practice and escalating them up, and perhaps even sharing them outside of your organization. So it's about the trajectory of just gaining experience within the audit process.
So as we've said that the template has TP activities separated, is there information in the template about data management, collection, as data is a crucial area of auditing, Jana?
Yes, so of course we have included this also in our template. A novice transfusion practitioner usually helps with the data collection. For example, she can collect data on iatrogenic anemia. Sometimes it can be difficult to collect certain data in the EPR, in the electronic patient record. For example, about the void volume. It can be good to, for example, observe any care unit and then collect the necessary data. Then experienced transfusion practitioner can be involved in maintaining records, databases, spreadsheets. And they can also play an important role in providing information to the relevant stakeholders, for example, the transfusion committee or blood management committee, but also colleagues from the quality department and so on. And then a senior practitioner, they can really think about how to create databases, which data should be involved integrated in databases, and also how to collect it in a very effective way without asking too much administrative burden from the healthcare providers. And then they can also really develop KPIs, think about what is important, the most important to evaluate a certain procedure.
With all these considerations to be had with auditing, are there any other resource or tools that we could also use to help our listeners?
Yes, the ISBT website is your go-to place for everything. So if you go to the Transfusion Practitioner page, which can be found under the Clinical Transfusion Working Party group, and if you go on the ISBT website, you'll see all the working parties are on there. By looking at the TP page, we can link onto all the resources. So we've started some audit tools. You can scroll through and find recordings from our previous congresses. And we did an interactive section on audit and data collection, analysis, reporting to support change management. So that's on there as well. And also, if the listeners had further questions about the audit and the role of the transfusion practitioner, then they can contact us through the ISBT office. And we're always delighted to get involved with people's questions.
Thank you, Rachel and Jana, for sharing your time and experiences with us all. The role of a transfusion practitioner is certainly diverse and has achieved some great outcomes for transfusion safety and improving patient care through auditing and feedback. Thanks so much to the listeners for joining us today. If you have any feedback or questions, you can link in with us by visiting the ISPT website and checking out the Clinical Transfusion Working Party, where you'll find more details about the transfusion practitioner subgroup. We look forward to having you join us in our next episode, which will focus on activities of the transfusion practitioner role related to transfusion reactions and include some tips and resources to assist. Until then, thanks for listening.